Hi guys, how are you? Hope you all are fine. So, if we see, like we all have came into the college, and sometimes at some colleges the staff don't teach. Yeah, so we are the one who have to take our own notes, study, write the exams, gain knowledge. So I'm here for you guys to make your hard work much simpler as much I can possible from referring standard books and standard guidelines for you guys. So today we'll see about the dyslipidemic drugs, and also in exams your Viva staff doesn't ask what are the six names of the drugs. He'll just ask why the statin causes some muscle pain and why the fibrate is causing the gallbladder, so gallstone. So today I'll explain this six dyslipidemia drugs classes from Dipiro with the concept. Also, I'll giving you some Viva points. And come, let's go in. So statin. So statin is under the class of HMG-CoA reductase inhibitor, where its example is Atorvastatin, where it comes between 10 to 80 mg. So if you see its mechanism of action, the liver makes the cholesterol using HMG-CoA enzyme. So when the statin blocks this enzyme, on the liver factory, and the LDL cholesterol will be increasing, the receptor will be increasing on the surface. So the more the receptor, more the LDL from blood is pulled inside the liver. So blood LDL decreases by 30 to 50 percentage. And here's the viva point. Why muscle pain causing over here? Because statin also blocks mevalonate pathway, where the mevalonate makes CoQ10, which gives the energy to the muscle. So when there is less CoQ10, there will be muscle pain, myopathy, and also in severe cases, rhabdomyolysis can also occur. So if you see in clinical terms, the statin should be taken at night because liver makes most cholesterol at night. And also, if you take grape juice with it, it increases the statin level, which may occur toxicity. You can see this in the Dipiro chapter 35. And next comes the Ezetimibe, which is under the class of cholesterol absorption inhibitor, and it is at the intestine brush border. So we eat cholesterol plus bile cholesterol comes from intestine. So NPC1 and L1 protein absorbs it, where the ezetimibe blocks the NPC1 L1, acting as a shield blocking the cholesterol dots. So here, when there is less absorption, less cholesterol reaching the liver. So liver compensate by pulling more LDL from the blood. I guess you got my point. So here comes the viva point in this. Why there is no major side effect in it? Because it does not enter the blood much, works only in gut, so it's a safest drug. Then if you see in the clinical side, the given with the statin will cause 65 percentage of the LDL reduction, and the combo name, do you guess? It's nothing but ezitrol. Next comes the fibrates. Fibrates, for example, Fenofibrates, which can be available in 145 mg, and it is the PAR-alpha agonist. So the PAR-alpha is a steering wheel in nucleus. So when fibrates binds to PAR-alpha, it increases the LDL enzyme, which is the vacuum cleaner in blood. So LDL breaks the triglyceride, also increases the HDL production. Then here comes the viva question. Of course, the side effect, the gallstone. Why gallstone is occurring? Fibrates increases the cholesterol excretion in bile. Hence, the bile becomes saturated with cholesterol, which forms as the stone. Simple as that. And then comes the clinical side. The drug of choice for high triglyceride, if it is more than 50 mg per dl, never give with statin because it can cause rhabdomyolysis risk. And there's an exception in this. Fenofibrate plus low dose statin is safer. Okay. Then comes the fourth class, that is PCSK9 inhibitor, where it is a Evolocumab, 140 mg, and should be given only in the subcutaneous. And it is a monoclonal antibody where its mechanism is like when the liver makes a PCSK9 protein, it destroys the LDL receptor. So more PCSK9 is equal to less receptor when where it increases the LDL. So what this antibody will do, it bind to the PCSK9 and destroy it, where in the result the LDL receptor stay on the liver surface and causing the LDL from the blood clear fast. So what happens? 60% of the LDL drops. Here comes the question. I guess you most of the people guess the question. That is nothing but why is given only in injection? Because it's a protein. If the protein taken orally, it goes to the stomach and it will digest it. So side effect will be injections, side rashes, flu-like symptoms, and all will come. The clinical side. If you take this injection, it's around 15,000 to 20,000 per month. So it's used only in familial hypercholesteremia or statin intolerant patient because more patient cannot afford this, right? Next comes the bile acid sequestrants. So, for example, it's cholestyramine, where we'll get in 4 grams packet. So, it's an anion exchange resin, where it's a binder resin in the gut also. So, here comes the concept. Bile acids made from cholesterol is normally 95% bile is reabsorbed in ileum. So, this drugs bile to the bile acid in intestine like security guard, and bound bile goes in stool. So liver has no bile, which is forced to use cholesterol to make new bile. So liver will have LDL receptor increases, so LDL falls by 15 to 30 percentages. Oh my god, you guys just imagine the India, how are they looking into the liver, and they are just discovering this beautiful drugs. Yeah, back to the our topic. Here comes the viva point. Why constipation and bloating in this case as a side effect? So, resonance not absorbed, it makes stool harder. So, why take 4 hours apart? It binds to the all drug, bro. Thyroxine, digoxin, statin. So, nothing will get absorbed. So, hence, it is taking a 4 hours apart. Then comes the clinical side. It's the oldest drug and also lowers the glucose. And it is bad, the patient complaints will be poor. So next comes our last class, that is niacin. Niacin SR is available about 500 to 2000 mg. So it decreases the hepatic VLDL production. So VLDL, what is VLDL, guys? VLDL is a precursor of the LDL. Now comes the exact MOA. The niacin blocks the lipolysis in fat tissue. What? The niacin blocks the lipolysis in fat tissue with the less free fatty acid reaching the liver. So less raw material is equal to less VLDL made. So since VLDL produces the LDL, LDL also falls. So here is the unique point of the drug. Only drug that raises HDL by 20 to 30 percentage, guys, and it lowers the triglycerides also. And for this, what could be the viva point? Of course, the about these side effects. So here, why is it causing flushing, itching, or red face? The niacin activates the GPR109A receptor, which causing the prostaglandin D2 release, and which that ultimately cause vasodilation. So for that, give aspirin 30 minutes before to block the prostaglandin. As simple as it. So here we'll see the clinical part. So there's no flush, niacin doesn't work. Exactly. So if there is no side effect for this, niacin is not working. So the external release is equal to less flushing, but liver toxicity will be risk. LFT monitoring will be needed for this drug. And I'm having a summary trick for you guys. Don't skip. Here is the summary trick that is SEF PBN. SEF PBN. What is SEF? You might guess right. Statins means muscle pain, Ezetimibe is stomach upset, Fibrates is gallstone, and for PBN it's PCSK9 injection rash, and bile binder it's constipation, and niacin it's flushing. So comment PDF and your email. I'll send you guys my notes and from what topics I had referred this. Thank you. We'll see you on the next video. Stay with me. It's Zen with Shifana. Bye, guys.